Hey, good morning and welcome to UroNurse News. Be sure to like and subscribe. Today we're covering exciting research that could someday change how we treat one of the world's most common cancers. Researchers have discovered that low-frequency ultrasound may be able to slow the spread of oral cancer cells and even make tumors more vulnerable to existing treatments. Let's take a closer look. When most people hear the word ultrasound, they think about diagnostic imaging. But researchers are studying something very different. Instead of producing pictures, low-frequency ultrasound produces gentle mechanical forces that physically stress cancer cells. Scientists at the Indian Institute of Science tested ultrasound operating around 40 kilohertz, dramatically lower than the frequencies used in medical imaging. When patient-derived oral cancer cells were exposed to these ultrasound frequencies, the cancer cells stopped spreading. Healthy cells, they were largely unaffected. That's an encouraging sign because one of the biggest goals in cancer therapy is selectively targeting cancer while minimizing damage to healthy tissue. Now, the investigators wanted to understand, why did this work? They discovered that ultrasound disrupted structures called focal adhesions. Think of these like tiny anchors that allow the cancer cells to grip surrounding tissue and move in the nearby areas. Without these anchors, cancer cells must struggle to migrate. The research also identified reduced levels of a mechanosensory protein called tryptomyosin 2.1 or TMP 2.1. This appears to make oral cancer cells especially sensitive to mechanical stress created by ultrasound. In laboratory testing, cancer cells showed less movement, less invasion, and increased programmed cell death. While these findings are currently limited to laboratory studies, these results are certainly encouraging. One of the most interesting findings involved the tumor's protective environment. Many oral cancers surround themselves with specialized cells called cancer-associated fibroblast. These cells act almost like a shield, making it harder for chemotherapy drugs and immune cells to reach the tumor. Researchers found that ultrasound reduced this protective barrier. As the barrier loosened, the tumor became more exposed. That raises an exciting possibility. Ultrasound might someday become an adjunct therapy, working alongside chemotherapy or immunotherapy rather than replacing them. Improving drug delivery could potentially enhance the treatment's effectiveness. Now, before patients get too excited, this is exciting news, it's important to remember that this research remains in the laboratory. No human clinical trials have yet demonstrated that this approach is safe or effective. The next step will include studies such as organoids or animal models, and eventually carefully designed clinical trials. Researchers have already received ethical approval for animal studies. One of the investigators said the most rewarding part of this research has been hearing directly from patients and hospitals eager to participate in future studies. That enthusiasm highlights just how urgently better oral cancer treatments are needed. While more research lies ahead, this study reminds us that sometimes entirely new treatment approaches come from thinking kind of outside the box. We'll continue following this story as additional studies become available. If you found today's report helpful, be sure to like this video, share it with your colleagues. On a personal note, I had a niece who died of tongue cancer, an oral cancer, and this kind of news makes me wish that she was around still to be able to try something like that. I'm Vic Senese, and this has been UroNurse News. Hey, coming Saturday on UroPatient, before you take tamsulosin, good old Flomax, there are some important facts every man should know. While this commonly prescribed medication can significantly improve urinary symptoms caused by an enlarged prostate, it isn't the right choice for everyone. In this episode, I'm going to explain how tamsulosin works, its most common side effects, including dizziness, low blood pressure, and ejaculation changes, and what you should know before a cataract operation. Join me on Saturday at uropatient.com, like it says up there. Tomorrow on UroNurse News, I'm going to take a deeper look at ESPLA's free-dried plasma and explore why emergency physicians, trauma surgeons, paramedics, military medicine, and hospital banks are calling this FDA approval a potential game changer for rapid transfusion. Who stands to benefit the most, and what this innovation could mean for emergency care in the years ahead. Join me tomorrow to get that full story.
UroNurse News every weekday at 9 a.m. Central Time, bringing you the news that shines. UroNurse News.